Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I'm the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thank you so much for tuning in to my podcast. I'm glad you're here. We are here doing part three of our series on estrone, the Forgotten Estrogen. And, the first ones we did, the very first one was just kind of like an overview. I wanted you to understand estrone and introduce you to her. And the second one, I went more in depth about estrone and its role with insulin and body metabolism and just overall inflammation rather in the body. Today, I'm going to dive more deeply into the role estrone plays in cancer. Now, I have kind of mentioned this casually throughout this series, and I even mentioned in episode 1, and I want to circle back to it now and be very precise with my words because it's important that you hear this. I know what happened with the nurses' study that was done in 2002. I know how that impacted you. I know because I was there very early in my practice, prescribing progesterone and treating women. I saw all of these women discontinue hormone replacement therapy with terror that they're going to die. And then their health just collapsed. I know that many of you feel very betrayed by the way you were treated, and you have every right to feel that way. And you're completely valid. And I completely stand beside you. I always have. I always have. When estrogen was vilified and called out as being the cause of breast cancer in women, it caused so many of you to be afraid of your own biology. You felt a part of you was bad. And this, unfortunately, is not the first time this has happened to women. Your bodies have been vilified in so many different ways. And shamed. You've been shamed so much. I know. I've been there. I've sat in the room. I've been present. Emotionally present. I have heard you. I want you to know, first know this, estradiol is not the devil. And estrone is not the devil either. These are not bad hormones at all. At all. What I want to be very clear and nuanced with you here today and always is to explain the precise way that these things can go wrong. My goal is to empower you, not frighten you. My goal is to give you something you don't have yet. That once you have it, it will be yours to keep forever. And that's knowledge. And I want to give it to you in such a clean way that you can take what I'm presenting and then spend some time on your own and research it and further enrich that part of your mind that understands your biology and how to keep it healthy and safe. This is it. I'm saying all this because I've done episodes, there have been reels released where I talk about cancer and estrogen, and I've gotten a lot of anger directed at me that I'm another member of the patriarchy or the modern medical establishment who's trying to take away a part of your biology, who's vilifying you, your biology, and shaming you. I'm not that person. So I'm going to be very precise with my words today when I talk about cancer. Our ancestors needed estrone. Estrone is beautiful and important. Let me step back. Remind you, just in case you're joining me for the first time. Estradiol is the primary estrogen that is dominant during your years of fertility. And she's beautiful. She stimulates the alpha and beta estrogen receptor. She's great for bone. She's great for brain. She's great for collagen. She's great for fertility, of course. She's great for so many aspects of you that make you you. And we love her. But just as in all things, she needs to be in balance. Your body can't just have one note pushing in one direction. There has to be counterbalances, and that's progesterone and lifestyle. Right? And we've talked about this in previous episodes. So that's estradiol. When you go through menopause, your ovarian reserve diminishes, and no longer do you make estradiol. What happens? Estrone steps in. Your body fat will aromatize something called androstenedione into estrone. Estrone is a very weak estrogen. But estrone is an important estrogen because it still binds to alpha receptors, the alpha estrogen receptor. It will help maintain bone density. It does a lot of the good things that estradiol did. Know this to be true. This is a very important fact. So our ancestors, postmenopausal, would have estrone to fill in the gap, to maintain bone density, to maintain their health, to maintain cardiovascular health, to maintain brain chemistry. So estrone did all that. The problem began, though, in modern society. See, estrone is a spark. All hormones are like a spark in a way. Estrone is like a spark, which is all hormones are sparks. And we want to look at the environment we're throwing that spark into. What is it going to be? And if the environment that estrone finds itself in is more pro-inflammatory, and there's more insulin resistance, there's more adipose tissue, she's going to continue to grow. See, estrone thrived among our ancestors when we didn't have as many calories. We don't have a Western diet. There was nothing refined in our diet. And it worked in those times because there was so much fiber and it was such a whole foods diet that estrone could not overblow. And that spark would not hit an inflammatory landscape, creating cancer that we see or we worry about. So it's not the estrone, it's the environment that it finds itself in. And in medicine, we have become so backwards with how we see this that we would rather shut out the estrone or estrogen period than understand the environment where we find it that creates the problem. So what's the environment that creates that risk and that worry? What does that environment look like? That's a poor detoxification, which we'll get into today. It's more pro-inflammatory with your diet, and your detox elimination pathways of your body are compromised. You're not able to get rid of it. And that's what creates this issue with estrone. Again, it's not estrone by itself. It's the environment within which we find it. That's the key to this. So let's talk about the initial stages of menopause, the early years of menopause, and why it's such a risky time for estrone to be elevated. Estradiol and estrone equilibrium shifts. Your body becomes more pro-estrone because, again, ovarian reserve is diminished and you don't have any more estradiol coming from your ovaries. You're going to make it from your own adipose. So now estrone is going to be generated from your body fat. We know there's less progesterone in the equation at this point. You're not generating progesterone. When you don't have progesterone, you remove the inhibition that progesterone was providing for estrogen receptor signaling, because we want the estrogen receptor to signal. We want estrogen to promote and proliferate, but we also need progesterone to modulate it. So if you don't have progesterone to modulate it, this is when we're going to see some problems. So without progesterone, we have estrone, and we have estrone dominance at this point. Okay, that's just the endocrine component. We know that estrone primarily binds to estrogen receptor alpha, and that's more pro-proliferative. Estrogen receptor beta is a little bit less, that's more modulating, but estrogen receptor alpha is going to be more proliferative, and estrone primarily binds to that. We also know that if there's an increase in inflammatory cytokines, interleukin-6, tumor necrosis factor alpha, that's going to amplify the estrogen receptor alpha activity, the proliferative component of it. And that's those cytokines I just mentioned, those are more pro-inflammatory. That comes from lifestyle. That comes from a highly processed lifestyle that we're in these days, processed foods and not eating as well as we could. So this creates the environment where estrone is going to stimulate proliferation without progesterone, because it's going to be hitting that estrogen receptor alpha. Estrogen receptor alpha is going to be turned up because of a higher incidence of inflammatory cytokines that are more commonly present in modern people. So that's just the environment that we see estrone being an issue and lack of progesterone being an issue. There was a reel we posted a couple of days ago. There was a woman giving a lot of really positive information around progesterone's benefits during this time with women and inhibiting that proliferation. And I want to stand behind her and tell you that that was actually really well said on her part. And I really appreciate seeing that in there. And that is the first step, is the hormonal component. But that's not enough, okay? Because this is the part where it gets dark, is the next phase of elimination of estrone through the body. Estrone in and of itself is not, cancerous. It's the metabolites of it. When your body has metabolic waste, it has to get rid of it. And that's normal. The liver does this, most of it, almost all of it. The liver does this process of, detoxification. And that happens in the cytochrome P450 system, which we'll be discussing a little bit more in detail now. Estrone's danger is not in its presence. It's in its phase 1 liver detoxification pathway and where it ends up going. You know that 2-hydroxyestrone, that's less harmful. That's the best one. That one's easily methylated. That one's the safe one. That's good. We also know that the 4-hydroxyestrone, that's going to be a little more dangerous because that's the one that promotes mutations. That's the quinones that promote more mutations. That's going to be your 4-hydroxy. And then you have 16-alpha-hydroxy. That's going to be this persistent proliferative signal. Okay, so there's 3 metabolites that can happen from estrone metabolism. You can either go in the nicest way, the best possible way. This is a true hydroxy. You do the one that's going to be a little bit more mitogenic or more pro-mutagenic, which is going to be the 4-hydroxyestrone. And then you're going to have the 16-alpha-hydroxyestrone, which is going to stimulate more proliferative, more pro-proliferative. So the 2 ones that we worry about is the 4 and the 16 pathways, because you're going to have the mutations from the 4 and you're going to have the pro-proliferative from 16. And this is the pathway we want to avoid. They come from when you have poor methylation, and it comes from poor glutathione conjugation. These are technical terms. I know there's some of my people who follow this are more nerdy in the science with me, and I don't want to over-nerd you up, but these are terms I think you should start knowing, at least hear them in the background. And these are the liver detoxification pathways. There's a lot of chitter-chatter on the internet about methylation, and a lot of it is like people trying to sell a product. I know this to be true, and I don't want you to ever be conned into buying junk unnecessarily. Actually, I don't want you to be conned ever getting junk, but methylation is a real thing. It's a real thing, and it is something that we need to be aware of because it plays a huge role in this phase 1 detoxification of estrone. And if we don't understand that and wrap our minds around it and have a clean understanding of it and a clean approach to it, we run the risk of missing it. And then you have a problem with these downstream metabolites. The glutathione conjugation, glutathione's a tricky one because this is a master antioxidant, as the saying goes. And that's an essential part of liver detoxification as well. This is a key thing that I test in my office frequently. This is not methylation. It's a little bit different. It's more about metabolism through the body. I'll get a little bit more in detail with that. But this is another pathway we need to be aware of with our patients. And these are things I can easily test in office. Not that difficult to test methylation. Not that difficult for me to test glutathione pathways. So we know that estrone metabolism needs to go down the safer pathway, the 2-hydroxy pathway. But I want you to know those other 2 pathways have been around forever. And all 3 pathways have been around forever. And our ancestors, through lifestyle and diet, were able to maintain the proper pathway. But even so, having these other sub-pathways being somewhat turned on a little bit, is that enough? No, that's not enough. I want you to know that. There's more to it. You can't just trigger the 16 pathway or the 4 pathway and figure this is it, you're going to have cancer. There's more factors I think you need to be aware of. Because I don't want you to just go out there and buy a bunch of, methylation supplements and glutathione support and just think we're going to fix it. That's not enough. That's not quite it. And a lot of people trying to sell a supplement will tell you it is, but it's not. It's not. It's not. It's not. See, the thing is that cancer needs an environment that will feed it. And insulin, cytokines, low grade inflammation, all these things will turn estrone spark into a blaze. This is where this goes. And this is what I'm really want to get rooted in. Not just telling you to take methylation support or not just say these glutathione support. I really want to go after the whole of you as a woman. A whole of you. This is a whole approach. We know adipokine imbalance. That's going to be something where you have low adiponectin. And this is a tricky one. This is something we can test as well. But this is something associated with insulin resistance. And when you have a person who has, a high glycemic index with their foods they eat, they're going to eat more processed foods, things with less fiber in it. We know they're going to have that adiponectin is going to be a little on the low end. That's going to increase interleukin 6. It's going to have a trigger for more leptin. You're going to see more aromatase. You're going to see more estrone production. So that's going to be that person who's eating a high glycemic index diet. They're going to be the person who has a high insulin. Adiponectin, as I mentioned, is going to be low, and it's going to lead to this problem. You're going to create a little bit more of an issue with estrone being higher from that. We know that insulin resistance increases estrogen production and IGF-1 signaling, insulin growth factor 1 signaling. We know that tumor necrosis factor alpha is going to stimulate the 17 beta hydroxysteroid dehydrogenase pathway. I feel like I just sneezed. And that's going to be favoring estrone dominance. And then we also know that oxidative stress favors quinone production. What was that I just said? That was a stack of 4 things. I wrote them as my notes to read and not forget. Why did I throw this stuff at you? Well, the adipokine imbalance, let me take them part one by one. Adipokine imbalance, like I mentioned, that is me wanting to remind you that you can't just eat a junky diet and take supplements and think it's safe. I really want you to revisit your diet. I really want you to go after the foods that you eat and really work at lowering the glycemic index of the foods that you eat. Eat more whole foods, less processed foods. One that our ancestors ate, simple foods, basic stuff. Insulin resistance increases estrogen production and IGF-1 signaling, and that's going to be that same pathway I keep talking about. It's estrone being triggered through these pathways. And then IGF-1 is insulin growth factor 1 signaling. This is going to be something that promotes growth. Tumor necrosis factor alpha, that's an inflammatory cytokine, again, comes from lifestyle. That induces an enzyme pathway that favors estrone dominance. That's the 17-hydroxysteroid dehydrogenase pathway, which sounds like I'm sneezing. You see, those metabolic pathways I just listed for you are only just part of it, but your whole body needs to be considered as well. We need to think about the whole of you as a person. We've mentioned this in previous episodes, but when you have higher levels of body fat, that's going to create more insulin resistance. That's create more body fat. These things keep driving up more aromatase. You're going to make more estrone. The more estrone pushing down these pathways is a problem. A compound called tumor necrosis factor alpha is going to induce your body to generate more estrone as well. So inflammation really is a problem. So I want you to consider eating a more whole foods diet. Like when I say whole foods, it doesn't mean shopping at that supermarket. It means eating old-fashioned foods, homemade things, simple things, basic things, And I want to talk about a case now that I think about frequently. And this is a cool little story. I have a patient who presented to clinic. She did everything right. She ate well. She never took any hormones, no oral hormones, nothing. She was always on point, She still developed ductal carcinoma in situ, or a DCIS, at age 54. Looking at her lab, she had high estrone. She had low estradiol. She had poor methylation. She had more of an inflamed body. Even though she exercised, she ate clean, there was still more inflammation in her body. When I ran her labs, the estrone being high over estradiol, the ratio is greater than 1.5 to 1, which means when I run her estradiol, if her estradiol is at 100, her estrone should be less than 150. And in my office, it should be less than 100. And my goal is always bring it down even further. We know that she was having issues with her methylation. And we also know she had issues with glutathione. And we ran these labs around it. She had elevated homocysteine, which is a marker of poor methylation. She also had elevated C-reactive protein, inflammatory marker in the body as well. And the thing was, is she had estrogen dominance, a high rate of those toxic metabolites. And that all occurred with her labs being inside the normal range. And a lifetime of her labs being in the normal range and not being exposed to anything crazy. I want you to know sounds scary when I just said to you that a woman comes into clinic with normal labs and she developed breast cancer. I want you to know those labs were only normal in the eyes of a doctor or a clinician or a lab tech that was just looking for basic trends, common numbers, averages. They're not pulling it apart and teasing out the whole of the woman in the room. Just because someone tells you your labs are normal, don't always trust it. You want to see your estradiol. You want to see your estrone. You want to look down these metabolic pathways to understand how you are with your detox of estrogen. That's going to be understanding, do you methylate? What's your homocysteine? Maybe run a genetic panel on there. What's glutathione pathways look like? Are you able to conjugate your estrone and get it out of your body, doing the safest pathway possible? Doing that simple lab work is very easy. It's not $1 million. And I use insurance-based labs when I do it. It's very rare that I need a boutique lab that insurance doesn't like to cover. Very rare for this. They're available, but I don't always need them. The goal of this is for you to be empowered. How do I treat these women? The goal is always to run these protective pathways. You know, think of her body for a minute with me. Think of the spark of estrone and think of what an inflammatory landscape looks like. An inflammatory landscape is brittle and dry. You know, just think of a place after a drought. You know, how do I fix that? I want to go in there and nurture her body. We want to promote a healthy body overall, you know. So, of course, run labs, but no matter what, every woman starting off as soon as possible, because even a woman in her 20s may not be high risk, but if I get her in the habit of doing this, the habit will stick, hopefully. So, you know, I want to do my best to support her body's detox pathways, and we're going to recommend her to be, you know, consuming a lot of cruciferous vegetables, a lot of them. Broccoli sprouts, cabbage, you know, Brussels sprouts. These are good things to be consuming. This is going to push that first metabolic pathway. I want to enhance methylation, and that's going to be using B12, methylfolate. You know, these are things that we know for sure, and then we run our labs around it to make sure that we're fulfilling that. Promote glutathione conjugation, and that's going to be something, and acetylcysteine, over-the-counter supplement in the States. That works really well. Glycine, you know, high-quality proteins also promotes glutathione. We want to maintain gut clearance, and that's going to be something called calcium deglucarate. That's going to help the body fully eliminate that estrone and not have your body recycle it through your intestinal tract. And then, you know, the balancing the progesterone. That's very important in this case, because using progesterone, that's going to modulate those estrogen receptors in a very positive way. Estrogen is not the enemy. Estrogen is not the enemy. Even estrone, the one that has a bad rap, it's not the enemy. You know, as a spark and a healthy terrain, she's going to stimulate bone. As a spark and a healthy terrain, our ancestors, it prevented you from losing weight and maintaining body fat so you could survive through the winter. I mean, this is our ancestors here. As a spark, she's beautiful. She's beautiful. She's not the problem. She's not the problem. She's not the villain. She's great. But it's the environment she finds herself in that we worry about. This is why, lifestyle modifications to lower estrone, going about improving sleep, diet, ultra processed foods, all these things. And I hear you in the back of your head, like, Brady just snuck sleep in there. What are you talking about? Sleep. Sleep does play a role. If we're not getting quality sleep, we're going to see problems with cortisol, which is a natural anti-inflammatory, going low, and that's important for inflammatory modulation in the body as well. Sleep is a key thing. So what's my takeaway here? I want you to step away from fear and into a place of empowerment. The key labs I want you to think about is going to be estrone, estradiol. I want you to be considering the estrone-estradiol ratio. Keeping the estrone equal to estradiol or less than estradiol is my preferred. I know the research says 1.5. I mean, you could be 100 estradiol and 150 estrone. Yeah, fine, you could be that way. But man, I really love to drop it further. That's what I want to do. We want to look for the estrone metabolites. We don't want to see how well your body's methylating. I want you to track C-reactive proteins, inflammatory marker. I want you to consider your insulin levels and monitor that as well. Homocysteine is a good metric of methylation, as I mentioned earlier. Glutathione is another way of looking to see whether you're conjugating. These are serum labs we can pull. And then when it comes to the terrain that we find the spark in, lower the insulin load. Eat foods that don't stimulate insulin. Eat vegetables. Eat protein. Eat less grains. Eat more beans. Eat more true foods. I want to close with this and my perspective on this. I treat hormones as data, and I treat it as information for me to work with. And when I look at that information, when I look at that environment with your hormones, I then take them and I look at the terrain within which we find them. And then I start to try and understand where things are moving through you. I do use lab work as much as possible. I don't want to guess. Another reason why I want to use lab work is because I intend to be a part of your life. I'm a doctor. If I was a salesman, I would just say, cancer is stopped by taking my supplement. There's no accountability in there, is it? I know there's a lot of influencers that say things like this and they sell the product. I want you to avoid them. I want you to find someone that'll be accountable to you, to work with you hand in hand and care about you deeply and want the best for you as a person. This is what it means to be a physician. And this is what you deserve. I hope this helps. I truly do. This matters to me deeply, this subject. This truly matters to me. To the degree I do a good job, press like. And, if you like what I'm doing here, please subscribe. And if you know someone who would benefit from the work we're doing and this episode, please share it. All right, next episode, we're going to sit down and go into greater depth of the lab work we do, the values I look for, how to interpret them more clearly. And then if not in that episode, the next episode, I'm going to go very precise into supplement routines I will use. Again, supplements are very important, but diet and lifestyle is the key foundational thing. You can't out supplement a bad diet. You just can't. So I look forward to these videos with you. I look forward to seeing you in the next episode. I look forward to your comments, and I truly appreciate you here with me. Bye.